Hello, welcome everybody. Today we're going to be talking about a really fun and interesting topic, and that is how much money does a hospital CEO make? My name is Dr. Jeff Comer, and I've been a hospital CEO for 20 plus years and counting. I'm also a doctor of psychology who focuses on psychoneuroimmunology as well as stress management. So, for those of you that have joined my channel before, you know that there are three questions that I get the most frequently. The first is, what the heck does a hospital CEO do? The second is, how do I become a hospital CEO? And the third is, if I become a hospital CEO, how much money am I going to make? The third one is what this video is about today. Now, the first two topics I covered in other videos, so I'll put links to those below. Make sure you go back and look at those again, or if you haven't seen them, check those out. And if you decide that you want to put in all of the education, the time, the experience that's required to be a CEO and become one, now take a look at this video and see how much money you are going to make. It's interesting, when I started putting this video together, I thought, well, this isn't gonna be too difficult. This is a pretty straightforward, easy one. And I thought, I'll just give them the mean hospital CEO salary and it'll be like a 30-second video. But like everything else in hospital administration, the devil is in the details and nothing is quite that easy. So I am gonna give you the mean salary of a CEO, but then we've gotta break that down because there's a huge standard deviation from that salary based on three factors, roughly three factors. The first is the actual person, him or herself. The second is the compensation model. And the third is the type of facility. Each of those three areas can dramatically impact your salary. So we're gonna talk a little bit about those. But as we get started, I will share with you the average mean salary of a hospital CEO. And in this nation, it is in general based on the revenue of the hospital. The bigger the revenue, the more salary you make. The smaller the revenue, the smaller salary. So in this nation, the average total revenue of an acute care hospital is $277 million. So if you are the CEO of a hospital with $277 million, you're gonna make just under $700,000. That is your total compensation, not your base salary, but your overall salary package, which we'll talk about in a second. Now, this data came from an article in 2020 Healthcare Finance News that referenced Total Compensation Solutions. They put this assessment together back in 2019, so the data is pretty up to date, a couple years old, but really, really hasn't changed that much in 2 years. They surveyed 1,345 acute care hospitals. Now, there are just over 5,000 hospitals in the nation when you look at acute care as well as critical access hospitals. So that 1,345 is a very good sample size. So I would say these numbers are pretty representative of what hospital CEOs make. I will admit, in my own experience, I found that the salaries that they report, which I'll get to in a second, maybe a little bit higher than I would have expected. Perhaps I just didn't negotiate my salaries well enough. I don't know. We all have areas that we can improve there, of course. But that is the mean salary. It's just under $700,000, $689,000 to be exact, for a hospital with $277 million of revenue. Now, the variation though is huge. So that range in that study was $274,000 up to $1.4 million. That's an enormous range. So let's get into why there is so much variation and so much difference in those numbers. So first of all, when you are looking at those categories I mentioned, the person, the comp structure, and the facility, the person is really kind of the simplest of all of them. That is the person who is interviewing for the job, whether it be me, somebody else. You have your own experience, you have your own background, you have your own education, you have this whole identity that is different from another person you're competing with. So I may be applying for a CEO job. I've got 20 plus years of experience of doing this. Now, I may have somebody who is competing against me for that same job who has 0 years. It's their first CEO job. Maybe they've been a COO for 5 or 6 years and they're ready to step up. That person in general is gonna make a lot less money than I will because I bring that 20 years of experience. The learning curve for me is very short. I know exactly what to do. I understand the politics. I understand the intricacies of running a hospital, whereas that person has some more learning, some more mentoring. So there's gonna be a huge salary difference between the experience levels. So again, everything that goes into the salary can be very skewed by the actual person who's interviewing for that CEO job, okay? So that's the first area of variance in total compensation for CEOs, okay? The second is the comp structure. Now, a lot of people that follow my channels are kind of early careerists. A lot of them are still doing hourly jobs where they punch in the morning, they punch out at night, they go home. There's not really a lot of total compensation. It's just 20 bucks an hour, 30 bucks an hour, whatever that salary happens to be. Very, very different for CEOs in hospitals and really all executive positions in hospitals. You have a base salary, but then you also have different incentives. So you might have a retention incentive, for example, where if you stay at the end of 2 years, you get $10,000 or whatever the number happens to be. That also goes into your total compensation. You may have productivity bonuses, and in fact, I would say virtually all CEOs have productivity bonuses, and they certainly should. Those may be based on annual growth, on revenue growth, on new admissions, on quality measures, on patient satisfaction measures. A lot of different things that could go into that, but you hit those targets and you get a certain dollar amount. That also adds to your total compensation. There's all kinds of different things though. If you're with an investor-owned company, you might have stock options, you might have ownership in the company, you might have deferred compensation that gives you tax advantages, you might have relocation bonuses, you might have different levels of benefits. There's a lot of different things that go into the base compensation, and that ranges quite a bit. So for example, I have found a lot of times an investor-owned company will pay a lower base salary than a nonprofit company, equivalent hospital size, okay, same, apples to apples. One is owned by an investor-owned company and one by a nonprofit. The investor-owned company may pay the lower base salary because they offer stock. They may offer higher bonuses. There's just a lot of different things that go into that. So again, your base salary somewhere could be, pick a random number, $200,000 at one hospital and $300 at another, apples to apples hospital. And then you might have different bonuses. So they may equate to the same total compensation, but that compensation is derived in very different manners. So that gets very, very complicated. I'm trying to keep this at the 30,000 foot level right now, but I want you to understand there's a lot of variation in CEO salaries based on how that total compensation is structured. And that's very important for you to think about when you get into the job market and you are competing for these jobs. You need to think, do I want a higher base salary and a lower bonus, or do I want to put more at risk and have a higher bonus potential? Do I want the stock? Do I want the mission-driven value of a nonprofit? A lot of different factors that go into that, but overall you do want to, of course, think about your compensation as a total overall package. Now, the third one, this is a little bit more difficult to talk about, and this is the actual facility itself. I mentioned that the hospital is really defined by revenues in terms of size. Now, some people think, well, it's bed size. You ask somebody, you're a CEO, how big's your hospital? And they'll say, well, it's 350 beds. Someone else will say, well, mine's 150 beds. I don't put much, what's the right word? I don't put much value into that assessment because bed size doesn't really translate to how busy the facility is. You can have a 350 bed, licensed 350 bed hospital that's only being staffed at 100 beds, and the revenue is much lower than a 350 bed hospital over here that's fully staffed and making a lot of revenues. So I, and most of the corporate HR folks that look at salaries and compensations, look at total revenues of the hospitals. It's a much more accurate way to look at how busy that hospital is, how complicated your job is going to be. A hospital with $400 million of revenue is going to be more complicated than one with $100 million of revenue. They've got more service lines, more physicians, more patients coming in. So as a CEO, you have a little bit more workload based on those factors alone. So hospital size being defined by total revenues defines a lot of the salaries. Now, I've got some numbers here that I'm looking at. I'll post them on the screen. But hospitals less than $50 million, the average total compensation is $274,000 for a hospital CEO. You compare that though to a hospital with revenues of 250 to 499 million, that salary total compensation, shouldn't say salary, total compensation goes up to 700,000. Again, huge range in those numbers, but you can see that they're driven by the revenues. Now, other factors when you're looking at the facility, in addition to the size of the facility, could be, and I've kind of mentioned some of these, but is it an acute hospital or is it a non-acute? So for example, a CEO at a 200-bed acute care hospital is going to make a heck of a lot more than a CEO at a 200-bed psychiatric hospital. That's not to diminish the role of a psychiatric hospital. I've run psychiatric hospitals. They're critically important in this nation, in particular with the behavioral health issues that we face nationwide. But keep in mind, a 200-bed acute care hospital has an emergency room. They have operating rooms. They have a labor and delivery suite. They have all these different services that a 200-bed psychiatric hospital does not provide. So the acute care hospital, although the bed sizes are the same, the complexity is radically different in an acute care hospital. Acute care hospitals are always more complicated than psychiatric hospitals of same size beds. Now, the revenues could be equal, okay? So you could argue that the complexity is the same from a revenue standpoint, although I will tell you right now, equal-sized revenue hospitals with psych versus acute care is still gonna be more complicated because you've got all those different service lines, more physicians to work with, more patient issues, et cetera, et cetera. So again, not diminishing psych hospitals. I've run them, I'm a psychologist. I've run acute care hospitals too, obviously. But again, you're probably gonna make more in an acute care hospital setting than a psychiatric hospital setting. That also goes for urgent care or ambulatory surgery center. They're just less complicated than an acute care hospital, so salaries will be different. One thing that's very important is a system versus a standalone hospital. Now, the majority of hospitals in this nation are now part of a larger healthcare system, but there are still standalone facilities out there. And if you're running an equivalent apples to apples hospital, one that's part of a system, one that is standalone, in general, my experience as well as the data show that you will make more money in a standalone facility. And the reason for that is in a standalone hospital as a CEO, you don't have all this help. You don't have people above you at the corporate office that have support functions and support roles that can come in and give you assistance. It is all on your shoulders. You have to have the knowledge, you have to have your team in place, and you are truly running every aspect of that operation. When you're a part of a system, you typically have matrix structures where you have dual reporting relationships. You have functional experts that can help your staff, provide information, provide data to them, provide knowledge, experience. So the job in a standalone hospital is a little bit more difficult because you don't have all that help. You're gonna make a little bit more money because of that. Okay. Now, I mentioned a little bit about for-profit and nonprofit. I won't go into that again, but there are definitely different salary structures. Typically, the overall total compensation will even out, but you're going to have different mechanisms to getting to that total compensation, which we talked a little bit about earlier. The other thing that you need to keep in mind is the hospital stable? Is it a hospital that's running really well? It doesn't have a lot of issues. It's got a population base that's growing, so you're growing with the population. It's doing well financially. It's got good quality measures, good outcomes. Now, you contrast that with a hospital that is a turnaround, that is struggling, it's losing money, it has quality issues, it's got medical staff issues. That is a very, very different situation between those two facilities. Typically, the turnaround situation is going to pay a little bit higher because it's a much more demanding and difficult job. So again, there's all these different factors you have to look at when you're comparing salaries and compensation among CEO jobs. And it becomes, there's some art to it as well as science. And the best thing is to educate yourself, understand where the compensation comes from, why there's all these different variances that are applicable, and figure out what is important to you. What are you looking for in your comp model? You can still negotiate these things, particularly with a standalone hospital. Some of the systems, the nonprofits and the for-profit larger systems, they're going to make you an offer and you pretty much have to take that. There's very little wiggle room, but that's not always the case. So you want to kind of figure out where can you negotiate, where do you have room to maybe focus on an area that you want. Maybe you want a higher bonus structure, maybe you want a higher base salary, maybe you want more deferred compensation. Those are all very important things for you to look at and figure out what's best for you and for your family. So again, I said I was hoping this would be a 30-second video. I'd just give you the mean, but it's not that easy. There's a lot of complexity in a hospital salary structure for CEOs. I hope this video has been helpful. Send me your comments, your messages. I really do enjoy getting those. I respond to all of them. And I've got some more topics I'll be releasing in the next few weeks, so stay tuned for that. And hang in there, and we'll see you soon.